Allora, abbiamo detto che avevamo questo appuntamento importante, la dottoressa Andrea Iaboni che lavora nel campo della cura della demenza e dell'Alzheimer, l'abbiamo qui, quindi a warm welcome to dottoressa Andrea Iaboni, who will be join us today for an important conversation on health and wellness. Good afternoon, dottoressa.
Good afternoon.
Ok, so che lei ha veramente poco tempo, quindi andiamo subito alle domande. Noi vogliamo sapere what is anxiety, what does it feel like? Questo è veramente molto importante.
So anxiety is feelings we have in our body that tell us that something's not wrong. People can feel scared, worried. They can feel like their heart is pounding. They can feel sweaty. All of these are feelings that when you have a little bit of them are normal. It's okay to be a little bit anxious, but when that anxiety starts to take over your life, that's a sign that anxiety is too much and is a problem that you should look at.
È molto 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 importante. How common is anxiety in older adults, and how can you help someone who has it?
Yeah, so I'm a geriatric psychiatrist, so I work with older adults, and I just was involved in a national Canadian anxiety disorder guidelines where we developed, information about how to treat and care for older adults who have anxiety. And anxiety is pretty common in older adults. Probably 20 or 30% of older adults will have anxiety that gets in the way of their life, maybe makes them too anxious to go out of the house or anxious to do things that they used to enjoy. And so in our guidelines, we came up with a whole bunch of information for older adults and for their families about how they can address it, and then also who they should go talk to about their anxiety.
Yeah, and,
so,
sorry.
No, it's okay. I was going to say checking in with your family doctor is important because sometimes anxiety can be a side effect of a medication or a sign of a medical problem. But also it could just be a sign of depression, for example, or stress that someone has in their life.
Yes. And what do you hope to achieve with your research, and how can the community help?
So with our guidelines, we really hope to raise awareness about anxiety and why it's a problem for older adults, that people will use some of our resources. They can find those online. If you look up Anxiety Guidelines Canada, for older adults, you'll find our guidelines there. And we also, so if we want people to know what to do, we also want to inform family doctors so they know what to do. And, this work is, I think, really important because it's not a topic that we talk about very much, anxiety in older adults. And so this work has been helped by the various research organizations, including at the foundation, the UHN Foundation has funded our work. And so we're really grateful to them for helping us get the word out about anxiety.
Yeah, this is very important to research and the donation. We're talking about in the radio to the donation. This is it's a goal from Chin Radio, so this is very important. Doctor, we know you are very, very, very busy. We want to just say thank you for your time dedicated to us, and we hope to hear from you in the future. So thank you so much.
Thank you so much.
Grazie. Ringraziamo la dottoressa Andrea Iaboni che ci ha detto: ragazzi, vado veramente di corsa, ho tantissimi appuntamenti, quindi thank you so much.